We have today Dr. Bob DiPaola, Provost and Executive Vice President for Health Affairs. Joined the university in 2016. He's helped lead significant growth in our academic, research, and healthcare missions while continuing to serve, while keeping service to Kentucky at the center of that work. From advancing the UK Purpose strategic plan to expanding opportunities for students, researchers, and patients across the Commonwealth, his leadership continues to shape the future of our institution. And so, Dr. DiPaola, we thank you for being here.
Thank you all for the opportunity, and thank you, Dr. Monday, for giving me a bit of time as well. And Carl, thank you for giving me a bit of time to kind of talk with you all. And I put together some slides, but we could certainly go off the slides, or we can, entertain, or I'd be happy to entertain any comments or discussion you have along the way. Anyway, appreciate the opportunity to be here. And as Dr. Monday pointed out, I'll just make a comment about that LCME review that he talked about. It's every 8 years. So it's reviewing a lot, to the points that were made. So it's a lot of work by a lot of people over the course of, essentially 8 years in between every one of those to keep up with things and build and grow and so forth. So it really is quite an accomplishment by obviously many of you and many of them. Anyway, so I'm going to talk about two topics, one a bit about the Office of the Provost, and then I think I partner with Dr. Monday over in the health system as co-executive vice president for health affairs, and I'm going to hit upon a few points there as well. He may have talked about that in the past, I'm not sure, but I may just talk about it from a particular perspective. What I also want to do is talk about some things conceptually, so just some concepts in terms of how say the Office of the Provost and the leadership, and actually this is really the case of much of the leadership throughout the institution, approaches many of the things that we do day to day. Decisions, solving problems, and helping as best possible support the infrastructure and the talent needed to grow the institution. I think the president usually says or has said in the past that you can have strategy, so you can have a whole plan, but you're going to need infrastructure, talent, and nowadays even more innovation. So to do that in a number of different components. You okay there? I got you. Oh, to be over there. So in terms of just a bit of an overview, in terms of the Office of the Provost, I put this slide up because a lot of the work that we do out of the office is overseeing 19 deans who are overseeing, as you can see there, 17 colleges, a grad school, and libraries. So, and if you look at the colleges, you all know you're part of them or you're supporting them in different ways. Oh, by the way, I think Dr. Monday didn't mention one thing that was really exciting this week was Mulch Monday. So I got to meet a number of you, and I see somebody that I think was out there earlier this week as well in the front here. It was a great opportunity to do that. So thank you all for all you do in terms of making this campus beautiful and wonderful for the students coming in. Anyway, but you could imagine the variety and certainly the different disciplines that are involved in all these colleges. Many of you are involved in one or more of these colleges in a number of ways. You know that. But when you think about the differences, it's unbelievable. I mean, you think about some of the healthcare related colleges, such as medicine, as Dr. Monday pointed out a little while ago, health sciences, dentistry, and so forth, nursing. And then you think about some of the colleges, engineering, communications, and so forth. What I would say is one of the greatest strengths we have here as a university is we are very comprehensive, and we have these multiple colleges, and within the multiple colleges and the campus, obviously we have many campus units as well, the vast expertise we have here to solve any problem is unbelievable. So if you were to say we have a problem, whatever it may be, pressures on higher ed, or the need to pay more attention to what the workforce is demanding of our students, and the need to maybe add more AI training for all of us, perhaps. We have that expertise here, and I think that's really key. When you think about the expertise, I use the term a lot, and I think others do as well, transdisciplinary expertise and a transdisciplinary strategy. How do we bring all of you that have different disciplines and the appropriate people to the table when you're trying to start something new as a programmatic effort, or when you're trying to solve a particular problem? We have all that across the campus. And as you know well, you could even walk the whole end of the campus. I was on one end of the campus before, walked over here. You could walk over to the healthcare areas as well. I mean, you have an opportunity with a contiguous campus. Now, granted, some of us, I know, are off site to some degree, but for the most part, we have a very contiguous, very comprehensive campus. But we have a lot of expertise out of these different colleges and the units that support the campus in different ways. So we've got to value that. And one of the things that I think is really important, and I'm sure you see this in the meetings that either you conduct or you're part of, is when you bring a meeting together and you have a whole bunch of people together that have different expertise, you got to really refrain from your own opinions and respect that expertise. And so on the next slide, I just wanted to talk to you about a concept. And I'm going to do that and then get into some of the specific things that we do out of the office. But this is a little bit of a diagram. When you think about starting with mission and purpose, all right, and then you go along this diagram and you see the next step is talent and a transdisciplinary strategy. And I just use that term. What I'm getting at is how do you reach out and bring the right people together that have different roles, different expertise to the table to try to solve whatever problem it might be. So think about some of the things that you may have been dealing with on a regular basis. If you think about it in the research realm, many years ago, or not that many years ago, Sharon Walsh, who is a researcher in substance use disorders, started to bring together a team of experts in different ways, right? To bring in and to solve that problem, to help the state in terms of substance use disorders. She brought a team that included staff that could be out in the community, okay, educating people who needed education on what to do and to get treated and to get care. She brought together disciplines like medicine and pharmacy and, and nursing and social work. And you could imagine the large team. That ended up resulting over time, building a smaller team into a bigger team, into a bigger team, and then got that $87 million award for the state of Kentucky, for the University of Kentucky, to actually launch programs that staffed sites in the community. When you think about the enormity of that and the number of people involved, to just even complete something like that is well beyond one college, it's well beyond one unit. It required quite a few people, many different disciplines all working together. So again, that concept of talent and expertise and support of that talent in different ways, that's that transdisciplinary strategy. Can't make it, though, without infrastructure support. So I think you understand infrastructure from the standpoint of facilities, the support around it in different ways, support that includes funding for projects, et cetera. And then you think about growth and innovation in terms of infrastructure support. So the innovation piece. I kind of look at that pipeline is really critical for all the things we do, all the things that we think about growing as the next project, the next initiative. How do we do that? But you need to bring the right people to the table. So as you see that in each of your roles, don't hesitate to think about that extra person that needs to come to the table that would be helpful in that regard. So if you're going to set up a new program or you have a group that's setting up a new program in whatever, in business, but you realize, you know what, the world needs to know more about AI, or students are interested in health-related business. You might need expertise in healthcare as well at the table when you're trying to design something like that. Next slide. So this is that kind of concept. And the reason I just say this, so I don't know, just maybe one takeaway from at least the perspective, whether it's right or wrong, there is some evidence and some data talking about that concept of a transdisciplinary approach. And if you look at that little graph there, it's basically saying, and it came from the research realm first, in terms of what does it take to actually have the most impact when you put together a group to have impact. And a transdisciplinary approach is everybody getting together focused on a problem, not having preconceived things that they've conceived of, and then bring those things to the table. So if you were making a new drug, a more multidisciplinary, interdisciplinary approach would be the expertise already designing the type of pill, and somebody else already designing where you would send it to, and somebody else designing the marketing. Then they all come together. But then all of a sudden they realize that the pharmacist and the medicinal chemist that developed the drug, it's not absorbed, in the stomach. You got to give it intravenously, so that they didn't talk before. So I don't know if that makes sense and rings true. But what you would like to have is everybody coming around the problem and saying, the problem is we need something to help this particular condition in this particular way, who do we need to bring to the table so that it makes the most sense? And then the other thing, I mean, I don't know, how many things I'm going to get to share here, but Carl's giving me a lot of time. What'd you say? I have another hour? Just kidding. I'll keep you on time. A 3E approach. So one way you can conceptualize it when we talk about anything we do in the office is 3Es. What experts do you need to bring to the table? Okay. What experiences do you borrow from? So you might think about, what does another institution do in that regard, whatever it may be? If you're dealing with something on a regular basis, you can always ask the question, what about for this particular thing does, and I won't name those other institutions, but there's nothing better than the University of Kentucky, but you can think about what they do nationally in other ways. So the experience base, and then the evidence, what's out there in terms of studies, what works, what doesn't work. So 3Es. I used to teach this to medical students all the time when they were making decisions, clinical decisions. Don't all of a sudden do a procedure, order something until number one, did you triangulate with the right experts? You're not missing something. Two, what are the studies? What does the evidence say? And what's the experience out there as well? It applies to pretty much everything. So just a couple of concepts. Now, maybe the more boring part, if I could go to the next slide, just some of the functions. But I would have to say some of these are exciting functions. Some of these are difficult functions, but we're all trying to do the right thing, and we're all trying to do it well. And we're doing it for, as said even before by Dr. Monday, for one mission, one purpose. And that is to help our students, to help our patients, and we've got to help our staff and our faculty as well, and figure out how to do that, because we have a strong mission here, and I think it's really important. So I'm not going to go through every single one of these, but I want to highlight a few. We talk a lot about development programs, and sometimes we don't talk about that enough, meaning how do we help our own people? You do that, there are programs for staff, there are programs for faculty. If anything, I think we need to pay more attention to that, because at the end of the day, the better we are, the better you are, and capable of doing what you do best and what you're passionate about, the better we'll do overall. And then it comes back to then that transdisciplinary approach, bringing together that expertise. So we do a lot with coaching. So there is coaching available, like for instance, for a lot of the deans and others, we think about that. Faculty hiring process. That is an extensive process. We hire nearly, if you think about the faculty and on the staff end as well, the hiring is a lot every single year. Obviously we lose some people, but we tend to hire more than we lose because we keep growing, which is good. That's actually a good sign. I think Dr. Monday, I don't know if you're on there, but I think we have, is it 8 cranes on the campus? So a sign of growth, okay, not for the sake of just cranes, but it is a sign of growth. It's the same thing on the recruitment end. In terms of staff and faculty recruitment, we continue to grow. We have more needs. We have to figure out how to continue to retain and increase recruitment in terms of talent. But it's quite a bit. I think, when you look at faculty and you say, well, how's the hiring process go so that we're paying attention to it, it rolls all the way up. So it could be that a chair in a department decides to recruit a new faculty member. Okay, that needs to be at least discussed with the chair, who discusses it with the associate deans, the dean, okay, of that particular college, and then the provost office as well. And in fact, any of the letters that would go to those faculty roll all the way up, meaning a letter doesn't go out until we've all been able to kind of take a look at it and be sure it makes sense, that things are right, that it's equitable, because you don't want to all of a sudden commit a big budget to one faculty member when faculty are sitting next to them and staff are sitting next to them, and they're not getting the same, fair treatment. So there's a lot of attention to that. Is it perfect? I wouldn't say everything's perfect, but it's a pretty good system, and we continue to try to improve it over time. So all faculty that I recruited, that all rolls up. Leadership recruitments are even a bit more intense. You might have seen some discussion more recently about dean recruitments. We have an extensive process, really pay a lot of attention, do the best we can, really pay attention to what we need in a growing university, in a university that needs to be innovative and grow, especially with the external pressures that are out there. We also do the same with associate deans. We're paying even more attention to chairs and so forth. So the leadership that you might see in a college, and now I'm talking faculty leadership, you obviously have staff leadership, and there's a lot of processes in place there as well. But there's a lot of attention to that. And if anything, we keep tweaking it, we keep trying to improve it, because if we don't have the best talent sitting in each seat in this institution, we're not going to be able to move as well as we could. And we're not going to be able to serve as well as we could serve. And that's on every single part of the campus, if that makes sense. So I'm not going to get into the specific processes, but I can tell you they're pretty extensive. It takes probably, for a dean search, it's like about a 6-month process. And even at that, before they start, it's a little bit longer than that. So if we start in the fall, the process would be completed by the next July, if that makes sense, to give you any idea of how long of a process that is. Anyway, and then you can see on the list a couple of other things here. We pay attention to exit interviews, so we understand things. There are various awards. You can see even sabbaticals, on the other side there, performance evaluations, orientations for new faculty. We've been really stepping it up in terms of orientations with especially the faculty, but especially the leadership as well. So we spend more time with different unit leaders. So Dr. Monday, VP Turner, myself, we get together with the deans that are coming in as new deans. Now we even have a meeting with the cabinet. The president, meets with them as well, so that there is a lot of orientation to have an understanding, so that they have an understanding of all the needs and what's going on in the university. So there's actually a lot more than I think people realize. And I'm not going to go through the rest of the list on the right, but I'm going to go to the next slide, talk about some of the other functions. And this is broken up in 2 areas, academic affairs and academic operations. When you think about academic affairs, you can see it includes some of the centers like the Shelburne Center, Gaines Center, and so forth. But what we're really talking about is supporting the faculty as they develop curriculum and develop new programs. Now, going forward, it's going to get more and more complex, because what students need in terms of workforce demand is going to get more and more complicated. It's already getting more complicated. Workforce, let's say a company or something, they want to hire a student, they want them ready for everything. I mentioned AI briefly before. You could imagine that. It's like, I want a student who comes in, or now an employee who comes in and is trained in our discipline, context and content-wise, but then also understands how to apply AI to it. Or if it's a bit healthcare related, yeah, they might be in business, or this is, a business related field, or finance or whatever it may be, but I want them to understand the needs in healthcare, the healthcare industry, because that's who we do contracts with, whatever that company may be. So you can imagine it's going to get more and more complex. And so what we've been talking more about is the need to start thinking about stackable credentials. So it might be somebody comes in and they're going to do a sports-related program, but they're not quite sure if it's sports business, if it's sports healthcare, or legal and policy aspects related to sport. So you could imagine some general plan in terms of their degree, but all of a sudden they start realizing that the workforce out there that they might want to be hired at wants them to have more expertise in this or that, and so how do we make sure that they have that with a certificate or not? It's going to require more collaboration across colleges. So think about the future in that regard and how we're going to support that. That's what, in terms of that support for developing the curriculum, it might be an online program, that this whole area or Office of Academic Affairs does out of our office, along with many others, because you could imagine all the types of supports that's needed for multiple units. Anyway, and then if you think about academic operations, I want to call out one thing. We have a faculty senate, which I can tell you I value. We got Hannah here, who is actually our new chair, officially starts as chair on Monday, correct? On Monday. We appreciate that you're here. And actually, she and I in a small group meet a little later today, kind of talking about what agenda she might have for the first meeting. I value Faculty Senate. When you think about what that represents, just like what you all represent, they represent the faculty from across the campus. So we're doing everything possible. Granted, it's kind of a new structure over the last year and a half or so, but it's incredibly important, and it gives us an opportunity to kind of get the pulse of the faculty, just like you get the pulse of the staff. And then we come together and have opportunities to kind of sort out what's best for that next step, what's best for our people as well. in terms of all the things that we need to do. And we have a number of projects in line. Some of it I've alluded to. It's like, how do we deal with the pressures that we're having, higher ed has overall, universities have overall? How do we deal with those pressures and the demands that are on our students and the demands from industry and the workforce in terms of what they're expecting those students to come out and do? And then the value of coming here and getting a four-year degree, coming here and having opportunities for other pathways as well, if that makes sense. And then I'll call out back to the left side of the slide. If you go to the bottom, general education or UK core. One of the things Hannah and I and some others were talking about, and we'll talk about a little later too, is what could be the role of all of us teaming up and saying, what are the critical skills that every student should have? To be honest, what every one of us should have, because it always never hurts to tune up. AI is an example. We created a 1-credit course here. Anyone can take it. You all could take it. We could take it. Anyone can take it. As just one example. But what are the critical skills? Well, we have general education here, and we have had many years ago what was envisioned as the 10 areas that every single student should be able to, be competent at. As it turns out, some students or many students come here and they've already had that credited from, say, prior work that they've done. You all know that. But as it turns out, the recent data we looked at, it's only between 25-30% or so that's the case. So most still need to complete most of those 10 or so competencies, you might imagine. But it's been a long time before we've re-looked at it in a very detailed way and started asking questions like, does it make sense? Is it even if they get credit for, say, the communications critical skill from one course versus another course? So we're going to take a look at it. And if any of you were involved in some of that, I would ask you for your thoughts on that. What do we do in general? And AI was one question, or analytics and so forth. What do we do with that? Well, right now we created obviously a 1-credit, course that's not within the core, but should that be? And then it might actually be an opportunity if we start thinking that way, meaning what do you do to equip students going out when you know that there are, whatever number of areas that you want everybody to be good at, whatever it may be. It might be team building. I just talked a lot about team building. I mean, whatever it may be, maybe AI, maybe other things. Anyway, but you could always take a look at the current list, but that has not been revamped and edited or modified in a long time. So it's time to take a look at it. But you could imagine once we do that, it might be an opportunity to do like we did with the AI course. You know what? This is a great thing for students to have this critical skill. Can we also make it as a course for all employees again? So just keep that in mind. We are thinking that way because, let's put it this way, right now, I don't know about you all, but I have a few kids and they're pretty proficient on computers and AI more than me, and I don't like that. So I need to feel like I can actually try to learn. I don't know how you all feel, but when you have these students coming through and all of a sudden they're sharper on that, we want to take that course as well. Anyway, we're going to pay more attention to that. Going to rely on the Faculty Senate to help with it, and I think there'll be some opportunities going forward for our students. I think there'll be opportunities actually for all of us as well. If I can go to the next slide. And so I'm going to pause there for a moment. I could maybe just keep going, just take questions at the end. But I just wanted to, shift gears a little bit because, and I actually think of it as really a continuous thing. I mentioned before the university is a comprehensive university. And it's even though we look at districts, so you might think about the arts district, the medical district, the engineering district, et cetera. You can kind of think about it in that way. But in truth, everything is very much interconnected. In fact, everything is very interdependent. So it's interconnected, it's interdependent. And the more we leverage that, the stronger we are, and the more interesting it is, and the more exciting it is, and the more innovative it is. So even though I'm going to flip over and talk a little bit about healthcare, the themes are going to be very similar. And we'll talk about that in a moment. So next slide, if I could. You may have seen this before if you had a presentation of healthcare here, but just to be sure that you kind of grasp, and I even have to always think about it too, because when you grasp the volume, the size, and most importantly, the impact we have for patients and the community and the state of Kentucky, it's enormous. It's unbelievable. I mean, the impact is unbelievable. These are just some numbers, but they represent the impact that we're talking about. When you talk about beds, it's really important. You know, what's the size of an average giant size solid hospital? Owensboro, pretty good size hospital. It's about 450 beds. King's Daughter is about 450 beds. If we total all of us as a system, 1,700 beds, almost 1,800 beds. And we have a plan, actually, Dr. Monday's kind of leading that plan, to have another tower. That'll get us to be one of the largest health systems in the country, okay? And we're getting pretty close. Now, why is that important? It's not just to be big and whatever, but I can tell you right now, we don't have enough capacity to actually help all the people we need to help in a timely manner. And we keep working towards increasing capacity, meaning the state as a whole needs us even more. So if anything, the capacity we're talking about is to increase to help more out in the community. And for any of you that are working in some of the healthcare related areas, the connection to all of our healthcare related colleges is critical, because the other piece that's not as much listed on here is the talent we need. We need to keep hiring every single specialty, all the different staff areas as well. In fact, we put together a slide, I don't have it here, but a slide that looked at all the different areas that we're hiring on a regular basis. It's almost 80 different areas. So technicians in radiology, technicians in the pulmonary area, in addition to physicians and nurses and dentists and so forth. So 6 hospitals, including the 2 hospitals you've heard about, obviously King's Daughters out in Ashland and St. Clair out in Moorhead. One of the things in the center that is really critical is it is integrated into all the things that we do that are strong academically. So the research and discovery from the state's only NCI, National Cancer Institute Designated Comprehensive Cancer Center, is connected to our health system. So patients coming in our doors, okay, here have not only standard care, but they have cutting edge things that are going to become standard of care likely down the road. So new clinical trial options and so forth. So a lot of patients come here to see if there is something even better or something where they don't have an option somewhere else. And you could imagine some of those scenarios, and I won't go into it in detail. And then some of the other things that are accomplishments in terms of, trauma. We do get a lot of trauma, unfortunately, probably because of the highways and depends on the weather. And in fact, partly trauma related. This past week, we had one of the highest levels of people coming into our emergency department. Now, that's not a good thing, but the good thing is that we have the expertise to help those people coming in our doors. And if anything, we need to continue to grow if we're going to serve more. Next slide. So again, if you've heard this before, let me just add to it just a little bit. But we always talk about, and Dr. Monday and I talk about this a lot, we kind of ground ourselves back to what is the mission, what are some of the things that are key or principles in healthcare. And we keep coming back to this. In addition to the things we do every single day, you always have to improve quality, you always have to improve capacity, access, all the things I just mentioned a moment ago. But we've put 3 pillars or 3 principles. I'm going to keep calling them pillars, principles. Sometimes I don't know if we ever decide on the exact term, but these are areas where we need to focus. One is advanced subspecialty care. The reason is we're the only entity in the state that does the most, say, transplant, for example. So these advanced procedures that if we didn't do them, a patient would need to leave the state. So this is so no patient needs to leave the state to get the best care here in Kentucky. Otherwise, they would have to leave the state. The second is taking care of our people and our partners. We want to be sure that every one of us, all of you, everyone, has access to the health system. We need to keep expanding in terms of capacity, and there's a lot of work to do that. Obviously, with the facilities, but the other thing we're doing is trying to increase what we call throughput, meaning opportunities for patients who maybe need to get from the hospital to rehab to do it in a more seamless way. It helps them, but then it also frees up a bed and an opportunity for somebody else that we can bring in, and our partners. We can't do it without partnerships. We do a lot, Dr. Monday, myself, and really a whole team connect with many partners throughout the whole state to be sure that we're helping them do the best of care. And I'll give you an example in a moment. and then distinction. And this is really important because if you go to a health system and it's not connected with all of the things that we do, you all do, the academic end, the research, the learners. I mean, all of these colleges, these healthcare related colleges are training the next generation. So it's the pipeline of additional workers over in the future. And the research, as I mentioned before, helps with that discovery. So patients are actually having an opportunity. And when you think about the workforce and job opportunities, there are so many that we have in so many different areas. So we actually help when you think about the impact. It's not only the patient care, it's the economy, it's jobs. It is really helping the growth of the state as a whole. Next slide. And this is just kind of a depiction. I'm not going to go through it in every single detail, but in terms of the reach, when you think about all of the different sites that we have as partnerships throughout, and kind of the bolded area in the box says greater than 500 outreach and 271 partner locations statewide. I don't know why we put his exact number because it keeps increasing, so that could be old already. But the bottom line is that it's quite a few that we pay attention to. Because if we can help bring up the level of expertise or support in different sites throughout the state, practices, other hospitals, they can do better, and it helps the state as a whole, especially in areas of greatest need. Next slide. Thank you. And this is just talking about, the concept of the two hospitals in particular that we really have kind of a hardwired footing in Kentucky in rural regions in King's Daughters and Ashland and St. Clair, which I mentioned before. And you can see kind of some of the pieces in the slides. At the bottom right, it kind of talks about some of the specific programs that we've helped enhance, because since we've been able to do that and they've been part of UK, there are more opportunities for learners and residency programs there. And I think Dr. Monday talked about the College of Medicine. When I was dean, I had the opportunity to be part of the growth of new campuses. And in those new campuses, it's education, okay, so in Bowling Green and Northern Kentucky, but it's also helping the health systems locally there as well. So when you think about all of what we do, kind of that distinction pillar, it's really important that we integrate the educational mission, the research mission, as well as the healthcare mission. Next slide. And I just put this in here to talk about how Dr. Monday and I kind of look at things in terms of two areas of focus: the infrastructure, we even call it a healthcare infrastructure team, and then the talent and programmatic development, and we call it the Excel team. So we actually have a very well-defined structure, and I won't get into any more detail than that, unless you have questions at the end. But what I do want to do is give you an example of putting it all together. Next slide. So this is an example of putting it all together, meaning what we are here as a comprehensive campus, where you don't think just of healthcare colleges necessarily. You don't think just, of engineering, arts, and sciences. You basically say, where do we have some of the biggest impact in this institution? So one area, interestingly enough, is on the left. How many of you, maybe you raise your hands, I can't tell on the Zoom, but how many have heard of Brent Seal's team and the work on scrolls and imaging scrolls? Just raise your hand. Okay, it's a good number of you. So, I mean, maybe I'm thinking about half in the room or something like that. So this is like crazy unbelievable when you think about it. So when you think about, history and understanding what's happened and then learning from history, cultures back, years ago, could you imagine an opportunity that all of a sudden now, where we didn't have it before, you could start learning what the culture was like, 2,000-ish years ago. And the reason is that there was this giant library in Herculaneum, so a city in Italy. Herculaneum is just north of Pompeii. So people have heard about Pompeii, right? You always hear about that here and there. Well, both of those sites got covered by a volcano, the Vesuvius volcano. So there's a big volcano there. Actually, I guess it gets intermittently active, but in the year 79, this volcano covered over both of those areas, okay? In Herculaneum, as it turned out, there was this giant library, but you could imagine the heat of the volcanic ash just made everything into charcoal, including the library. And back then, In the year 79, the library consisted of these very well-established scrolls. You could imagine those are the very similar scrolls that are in the Bible. That they built the Bible out of, for instance, Dead Sea Scrolls. So you could imagine that. What that's like. Papyrus is what they call it. I've even gotten into the science of papyri, and then there's a whole field in terms on the more literature end on how people read those things. But anyway, nobody could even do that because there's this whole library, and all it is a bunch of charcoal scrolls. So some years ago, they actually tried to break them open. Every time you tried to break them open to read them, it all fall apart. Well, lo and behold, our computer science team, led by Brent Seals, figured out a way to take CAT scans, basically it's human CAT scan technology, okay, soup it up a bit, add AI, and could actually then image a scroll and read it, just like you're reading a book, which is pretty interesting technology. And so got grants, developed it over many years. Now the rest of the world is using that technology. And more recently, everybody decided that it would be a challenge, and a particular group gave funding for what's now called the Vesuvius Challenge. So who can read the scrolls fastest? Okay, so they already started doing that. It's already interesting. I'm not going to share it with you. That'll be another visit here, so you can read about it. But you could imagine by next year, those will be read, and we're going to learn a lot. And you learn what happened back then. You learn what advice they may have had back then. Some of it relates to Stoic and Epicurean literature. We don't know what else might be there. So year 79, at the site in Herculaneum, Italy, which is on the coast on the west. Anyway, and there are a lot of interesting stories about that time in terms of kind of the Roman history and so forth. But anyway, we're going to learn a lot. And if you wanted to, and you go to a store or you go to Barnes & Noble where they have National Geographics, this month, August, you know what the cover is? Is that. So the cover is all of that. And if you read the article, it's all about University of Kentucky team developing this technology. So anyway, but I'm not going to stop there. I want to finish the story because what we thought, thinking about a transdisciplinary approach, how do you harness that kind of expertise to even help more on the campus? That's engineering, computer science. So you know what we did? So Dr. Monday and I, we supported a program that's ongoing right now. It's called Heartland. So that's the next box over. Transdisciplinary team, 19 faculty, staff. So it's 19 faculty, staff, clinicians, researchers, and trainees. Actually, I think it's grown to closer to 30 or 40 right now. So this team gets together on a regular basis. You know what they're doing? I mentioned before, it's CAT scans, right? Well, we have human CAT scans. It's AI technology that no one else could create. So they're actually going through human CAT scans. They have all the images, or lots of images, I should say, thousands, where they're going through to see if we can, or they can, with their technology, discern things out of a CAT scan, looking at coronary vessels, so heart vessels, that'll help be more predictive in terms of how we help people live longer lives. Okay, and to make that even a little clearer in context, right now, if somebody's cholesterol is real high, what do people tend to recommend, or what have you heard out there in the press? A statin or drug. They try to lower cholesterol. Okay, lots of evidence that cholesterol links to heart disease, links to mortality, how long people live, but we do it at a certain level. We don't know if maybe for some people, if you had a CAT scan of their chest and you could see inside their coronary arteries, unwrap the coronary arteries, think about the artery a lot like a charcoal scroll. If you could learn something and understand that maybe you should be treating those people differently, and because of that, they would live longer. So that's at least a hypothesis, or one hypothesis. But to say that we have expertise from engineering as well as linking to radiology, cardiology, and so forth, and up to the right is just some of the images that they're looking at and maybe how they're looking at it. But I thought this was a really good example of taking the stellar work that we do here at the University of Kentucky, taking that transdisciplinary approach and say, how can we actually be aspirational, do better, and something more impactful, and something that harnesses the expertise and brings a large team together for a bigger a bigger impact for what we do every single day. And you could imagine the students involved as well, learning all these different processes. Next slide. Oh, I'm sorry. Do I have time for one more story? Okay. Or one more idea in terms of this. And I apologize if I've gotten too conceptual versus just talking about specifics in the office in terms of numbers and everything. But when you think about that concept, okay, the other thing that we have here at the University of Kentucky that I think is just unbelievable is if a patient comes in, okay, I know I've gotten a little heavy on the healthcare end, so I apologize, but just like with the engineering example with Brent Seals, you can see how it all applies and we all connect. But if somebody came in with cancer and it was complicated and they don't know if they need to see a medical oncologist and they don't know if they need a surgeon, they're not quite sure. We have teams and we call them tumor boards. So it means all the disciplines sit at the table, including, pharmacy, the pathologist, the radiologist, and they go over together the situation. So they'll present the x-rays on a screen. They'll present the pathology that's there, so the biopsy result that might have been of the particular, the patient that they're trying to help. They'll have a medical oncologist weigh in, usually a couple of them, radiation oncologist weigh in, a surgeon weigh in, and they'll craft a whole plan for them. Well, as it turns out, nowadays with cancer, and even just in day-to-day life, you can check all your genes out, like you can actually do an analysis of your DNA. You can analyze or do genomic analysis of tumors, and you can do a better job in even crafting the actual therapy based on the gene changes or genomic changes of that tumor. Now, I don't know if everybody's heard of 23andMe. Remember, that was a company where you could get your DNA analyzed and you could know if you could drink coffee before you go to bed because you metabolize caffeine better or not, or what drugs you should worry about, that kind of thing. So people can do it in general, and it's getting better and better over time in terms of how to do it. But in the cancer world, it's really important because every cancer is a little different, meaning it became a cancer, and you could tell from the biopsy because certain genes changed. So some change occurred. And so the question is, what change occurred? And if you knew that, would you do better? So could you imagine in this room, kind of like you see right there, and they're looking up at a patient's particular x-ray, and they're also looking up at the genomic changes in that patient's particular tumor. This is a real patient. So back in about 2011, we started what we called the molecular tumor board. Now, this was in my prior life. We started it here as well. 12-year-old, obviously with a really dire situation, a tumor that was in the brain, spread throughout the whole spine, and the X-ray up in the upper right in the picture, and the depiction is the X-ray. By the way, it was published. You can see we published it at the bottom. So the metastases. Well, what did we do? Did genomic analysis, and a whole group of experts went around the table. So this really happened. Went around the table and said, what can we do? Looked at the X-rays, understood what prior chemotherapy, which wasn't working anymore. How can we help this person, this kid, or this child? Anyway, so next slide, if you could. It showed 3 alterations. Back then, 2011-ish, I mean, it's published later in 2014, but that was about 2011. There happened to be a specific drug, and it was a pill that targeted that first one, a BRAF mutation. That's actually was known back then to be a cause of adult melanoma, but nobody would have even thought that it was a cause of this. The problem is there were 2 other alterations as well. There wasn't a drug available at that time. Now we have lots more drugs. Anyway, it was an opportunity for that expert group to say, hey, you know what? Nobody else in the world knows what to do for this 12-year-old child. We have a plan, and it actually did pretty well. Now I can't say it was perfect, but then again, we had an opportunity to be helpful. But it gets you to the concept of a transdisciplinary approach, the concept of bringing expertise. In this case, at the table, you've got basic scientists who understand genes and genomics. You've got pharmacists, you've got clinicians, and so forth. And the last thing I'll say, I think this is the very last slide. If you could go to the next slide. No, just one before. We're also in the health system, just like that thematic concept I mentioned in education, where we're going to need to bring colleges together under programs that relate to a sport career. We're going to need to bring together colleges that relate to developing programs in a healthcare career. maybe in a business or entrepreneurial career. You think of it thematically. We are doing that in the health system in multiple areas where, as I mentioned earlier, when somebody comes in with back pain and we have a spine center, it's what we call a service line. So they don't get just an opinion by an orthopedic surgeon. They get an opinion by an orthopedic surgeon, a neurosurgeon, some rehab expertise, pain control expertise, anesthesiology. Those are separate departments. Without having some sort of structure where we bring it all together, you don't bring those experts to the table. It gets back to the same concept as a transdisciplinary approach. So we call them service lines. In many cases, you call them centers. It's important in that regard. And I think that is my last slide. The next slide is, yeah, I don't have any slides after this. I was going to make the comment about the 8 cranes, but I think I did that already. But the infrastructure is facilities, the infrastructure is support. The infrastructure would include a number of different things. Many of you help with that as well. Many of you help with many of the programmatic things. And I just personally thank you because we can't function without us all teaming up together. And I've already emphasized that transdisciplinary concept a number of times.